Hi, my name's Spencer Bernstein. I've been at Remedium for 6 years. I am Divisional Manager and Head of Executive Search. The whole point of an international project is to be able to recruit for that trust at pace and scale.
So my name is Zoe Parks and I'm Head of Medical Staffing in the Southern Trust in Northern Ireland. We've struggled with filling medical posts for quite a number of years, and I don't think that's peculiar to Northern Ireland or indeed the Southern Trust. That's an issue right across the UK.
So I'm Imran Yusuf. I'm Clinical Director of Radiology Services in Southern Trust. The reality is that trying to get a candidate who will be fully trained and integrated into the system and will hit the ground running was probably wishful thinking. It was not going to happen.
Since Remedium's fruition, we complete on behalf of the Trust 2 to 3 projects a year. This specific project this Southern came off the back of a very successful project we did with Mid-Yorkshire.
When we heard the success of the body recruitment with Manchester and then Yorkshire, we decided that we would try something new and see if we could also attempt something on a volume scale.
So prior to the trip as well, Remedium delegates actually went to Northern Ireland. They went to the Trust to walk the floors, the wards, meet the clinical leads, clinical directors, HR, to really get a feel and understanding of where these doctors were going to go once they secured a position.
So we need to have a thought process where we can bring someone in who will be trainable and then integrate well into the system. And the things that you would want is a candidate who would be at a certain stage in their career where they are willing to learn a new system, also to pick up new practices, and be in a receptive phase of their career.
Our ability to go out to India and our ability to take 6 senior associate medical directors and clinical directors out to India with us, I think had a really good benefit for us. It gave our clinicians the opportunity to see what life is like out in India, to meet the other doctors out there, to sort of immerse themselves in the culture and just be aware of how those hospitals operate with our visit to a local hospital in Mumbai.
From start to finish, we can, as I said earlier, we can deep dive into the requirements. We can then land in Mumbai. We have interview days set up across 3 days, and that trust knows they are coming back having hired 70 doctors. A fully staffed office in India means that we have access to doctors going through the system in India when they are receiving their postgraduate qualifications required to work in the UK, MRCP, MRCS, MRChem, as well as the English language qualifications and gaining full GMC registration. This is how Remedium become experts in firstly international recruitment, secondly international projects at a high volume level, and we're able to deliver. Days are spent back-to-back interviews because there is a lot of doctors that needed to be hired.
So if they are willing to learn and get through that training process and get all the documentation required, then we would like them to change, to convert into a substantive consultant.
So the benefit of using Remedium as our partner in this project has been immeasurable in terms of our ability to focus on the doctor and not have to worry about all of the processing and paperwork that has been done on our behalf by the recruitment company. So we were able to focus much more on welcoming the doctors, much more on the pastoral support that we could put in place for our doctors, much more just recognising what we needed to do for them. The benefit of having Remedium as our partner was definitely something that we couldn't have done without, and something that they were able to share their expertise with us, and also take forward lots of things that we couldn't have done with such a large body of recruitment.
Having successfully recruited these 70 doctors, Remedium then held a social event so that Southern, the department leads, the department heads, HR, and all of the doctors that we placed and their families could attend a social event, they could meet each other, they could discuss about their induction periods, how they'd been settled into the trust really well and had the support that these international doctors require. We are looking at longevity here, for a doctor not to be here for 6-12 months. These were 2 to 3 year contracts where these doctors are going to get the support from the trust, be it training, Caesar, they have longevity careers here at Southern Health.